Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. This video is part of a series that I'm doing on nutritional psychiatry. So far, those videos include the Mediterranean diet for depression, your gut microbiome, magnesium for anxiety and depression, and intermittent fasting for depression. If you haven't seen them, I've organized them into a playlist called Nutritional Psychiatry. Today, I'm talking about curcumin and how it helps depression. Curcumin is an organic chemical found in the root vegetable turmeric. Turmeric is in the ginger family, and it looks similar to ginger, but it has a vibrant yellow-orange color. Turmeric is used as a spice to flavor curry and gives it the yellow color. There have been several studies showing that curcumin produces a modest improvement in depression. Less so with pure anxiety, and more so with people who have a mixture of anxiety and depression. And this is good because anxious depression is usually harder to treat than depression without a lot of anxiety mixed in. I have references to the studies in the description. To understand how this works, we have to look at the three models of depression. The first model is the low monoamine model, which means depression that is caused by having low levels of serotonin, norepinephrine, and dopamine. And this is what we used to refer to as having a chemical imbalance. And many of the antidepressants work to increase the levels of these chemicals. We understand now, though, that depression is much more complicated than simple low levels of these chemicals. A second model is Hpa Axis Dysfunction. HPA stands for hypothalamus, pituitary, and adrenal gland, and it's a feedback loop. How dysfunction with this loop actually causes depression is complicated, but suffice it to say that depressed people have a breakdown in this feedback loop that causes them to have elevated levels of cortisol and increased inflammatory chemicals. Now, you can have elevated cortisol for other reasons, but what we know is depression causes the system to be overactive, and the end result is an accumulation of cortisol and inflammation. An active area of research is trying to find a drug that targets the system. The third model is neuroinflammation and impaired neurogenesis. This means that your depression is due to increased inflammation and decreased nerve repair and growth. I grew up in Daytona Beach, Florida, home of NASCAR racing. During a race, the cars would pull over for pit stops where a team of people would quickly change the tires, make repairs, and refuel, and then the driver would get back in the race. I compare this third model to having a pit stop for the brain. Our daily behaviors and body functions cause a buildup of inflammation, toxins, and dead or damaged cells. And one of our pit stop team members is BDNF, which is brain-derived neurotropic factor. I talk about BDNF in my video on magnesium and intermittent fasting, and I call it fertilizer for the brain. Well, in this video, you can think of it as one of the pit stop guys scrambling to repair cells and get you tuned up. We know that people with depression and anxiety have low BDNF levels, so you don't have enough pit stop team members to do the job. So where does curcumin fit into this picture? Curcumin is a flavonoid polyphenol which acts as an antioxidant and reduces inflammation. In its antioxidant capacity, it reduces free radicals that cause cell damage. So it works with the pit stop crew. Other examples of polyphenols are red wine, dark chocolate, tea, and berries. And even though curcumin comes from turmeric, you can't get enough curcumin from eating turmeric to have the antidepressant effect. For one thing, curcumin is poorly absorbed and rapidly metabolized by the liver. So to make it more bioavailable, the supplement is combined with other agents like black pepper, essential oils, or soy lecithin. How much you need depends on the formulation, but I've seen average doses of 1,000 to 1,500 milligrams a day. Curcumin is generally well tolerated, but turmeric contains oxalates, which can increase your risk of kidney stones if you took it in too high of a quantity. Curcumin extracted from turmeric doesn't contain the oxalates. So there are turmeric supplements, But I think a better solution is to have the curcumin supplement. It may take about 2 to 3 months to see an effect. And how do you measure that effect? You look at your target symptoms. And this is how you would determine the effectiveness of any intervention. Your target symptoms are the things that aren't right about you. So let's say your sleep is off, you have trouble concentrating, you feel sad and cry almost daily, and you have bouts of anger. That's 4 target symptoms: sleep, thinking, sad mood with crying, and anger. Then, after a few weeks or so, you look at those symptoms and see if any of them have improved. Improvement doesn't mean everything goes back to normal. You may have 2 out of 4 of your target symptoms get better, but not completely resolved. I think with the food and other natural remedies, it's more realistic to expect small changes across multiple symptoms. And just as people talk about having multiple income streams, with the natural approach to depression and anxiety, you want to use multiple approaches to reduce or eliminate your target symptoms. So for example, the intermittent fasting may help best with mental clarity, but not so much with your sleep. The magnesium improves your sleep, but doesn't do much for your anger. Exercise and meditation help the anger. This is just an example to illustrate how you need to take a layered approach to natural solutions to your mental health. If you expect one thing to erase all of your symptoms, you'll be left believing that nothing works. And layering interventions takes discipline and patience to stick with it. Take a look at these other videos related to nutritional psychiatry. Thanks for watching. See you next time.